Nightingale Healthcare has been providing hospitals with travel nurses for 10 years. We are now one of the top 5 travel nurse companies in the United States. In addition to travel nurses, Nightingale provides allied health professionals and IT consultants to hospitals in all 50 states. Many travel nurse companies have a concentration of nurses in specific areas of the country. Nightingale looks at recruiting in a different way. Through our proprietary recruiting methodology, we are able to quickly react to our clients' needs, regardless of geographic area. In today's economic climate, every business has to carefully watch its spending. Hospitals are no different. Many of our customers have selected our Tier 1 program, which provides a significant volume discount opportunity. In fact, we have customers saving several $100,000 a year. At Nightingale, we are heavily involved in assisting our customers with their electronic medical records programs. Implementing EMR programs is and will continue to be a critical challenge for hospitals over the next couple of years. Nightingale provides nurses and nurse training in these situations. We also assist hospitals with their programming and project management efforts to timely implement EMR programs. Nightingale became Joint Commission accredited in 2008. This was a voluntary decision, but we felt it was important to subject our company to the same type of audit scrutiny as our customers. Our quality assurance program requires all nurses to go through a 3-pronged interview process before being submitted to our hospitals. They are first interviewed by a senior recruiter, then our nursing department, and finally by an account manager. We have 50 trained recruiters working with nurses across the country. When a customer has a critical staffing issue, all of our recruiters go to work to secure a qualified nurse to help out. We have a database of over 495,000 healthcare professionals who work with Nightingale Healthcare on a temporary basis. Some states have a long lead time for a nurse to get licensed. In some cases, the process can take up to 16 weeks. Most of our competitors will throw this task to the nurse and tell them that when they are licensed, the company will look for an assignment in that state. At Nightingale, we've set up licensing programs through the State Board of Nursing so that we can handle this process on our nurses' behalf. As a result, many of our customers will commit to hiring our nurses prior to receiving their license. Our customers are comfortable knowing that Nightingale is driving the process and reducing the overall lead times. One of the things our customers tell us they like best about Nightingale is that it's managed and run by the owners. Who better to make sure that we stay focused and do the right things for our customers?